Hi guys, I am back with another video and today I am going to discuss the congestive heart failure. So let us begin. So what is this congestive heart failure? So it is also known as heart failure. It's a medical condition in which the heart's ability to pump blood is compromised. Okay, there is failure of heart to pump blood appropriately. So that's why we get lots of symptoms. Okay. So then we have word pump failure. So pump failure is basically right side or left side sided heart failure. Okay. So yeah. So so in this case the this heart it, it is unable to oxygenate the blood the body. So that's why we get a ton of symptoms. Okay. Now, pump failure. So, um, so as you all know that we have two side of heart, right side and the left side. Okay, so there might be right side heart failure or left sided heart failure. Okay, now coming to the causes of the left sided heart failure. So, so the cause in ischemia. Now, now why does the left why does the ischemia cause the left side heart failure? Is that see? So, so our heart requires oxygen to survive. Okay. So, whenever it does not get the enough oxygen, it will die. Okay. And the ability to pump the blood by the left heart will decrease. Okay. So, consequently, it will cause various symptoms. Okay. Hypertension. So, hypertension. Okay. So in this case, what happened that the stress on the myocardium of the left ventricle will cause the muscle cells to hypertrophy. Okay. So hypertrophy is basically when the heart muscle see if this is the normal heart muscle, then this will be the hypertrophied heart muscle. Okay. So more oxygen will be required to oxygenate this part of the heart muscle. Okay. So it will eventually cause the ischemia and cause the sided heart failure. Okay. Now, dilated cardiomyopathy. So what happens in this case is that our left ventricle it get dilated. Okay. So so the blood can't be pumped efficiently into the aorta. So yeah. So this is also one of the cause of the left side heart failure. Okay. Now myocardial ischemia. And this is complete necrosis of the heart muscles. Okay. And the restrictive cardiomyopathy. Now, what happens in this case is that there is a impairment of the blood coming to the heart, like the venous system. There is some obstruction in the venous system, so that the heart can so the blood the 4.5 liters of blood come to the heart, okay, in 1 minute. Okay. So in this case, less blood will come to the heart, so it will cause a left side heart failure. Okay. Now guys, as a clinical consequence of the left heart failure, we will get the pulmonary condition. Now the idea here is that the left ventricle is not able to pump the blood to the aorta. So that's why what happens that the blood which is coming from the pulmonary artery will get pile up. Okay. So pile up will cause the hydrostatic pressure to increase. Okay. So as the hydrostatic pressure will increase, it will cause the edema to form. Okay. And edema is very dangerous. Okay. It will cause the paroxysmal nocturnal dyspnea, uh, which is basically the patient can't breathe at night. Okay. And orthopnea means the dyspnea when the person is lying down. Okay. And crackles are the features of the lung sounds. Okay. Now heart failure cells. So what do I mean by the heart failure cells? These are nothing but the macrophages which are in the which are surrounding the alveolar space. Okay, alveolar space. So as there is edema, the fluid will that is coming from the pulmonary artery will be consumed by this by this macrophage. Okay, macrophages. And these macrophages will gain the red color. Okay, so uh, so these macrophages are then called as a hemosiderin laded macrophages. Okay, and and these are also called as the heart failure cells. Okay, and this is very important consequence of the of this left heart failure. Okay, and decrease for perfusion, as the left ventricle is not able to pump the blood to the aorta, the blood flow to the kidney will be decreased, and as a result it will cause the activation of the juxtaglomerular apparatus. Okay, JGA apparatus. Now, this JGA apparatus is very important for the activation of the RAS system. RAS system, you know very well what is RAS system. Okay, so the final product of the RAS system, that is the angiotensin 2, it will constrict the arterioles and also stimulate the and also stimulate the adrenal cortex to release aldosterone, which will cause the sodium and water to reuptake, and therefore increasing the blood volume and therefore worsening the condition. Okay, and the treatment of this condition is giving the ACE inhibitor, that is the angiotensin converting enzyme inhibitors. Okay, now let us talk about the right-sided heart failure. So the most common cause of this right-sided heart failure is the left-sided heart failure. Okay, as you all might know that the right heart is is responsible for pumping the blood into the pulmonary circulation. Okay, and the left heart is responsible for pumping the blood into the aorta. Okay, so as there is left ventricular dysfunction, so it will cause the impairment in the right ventricle. Okay, okay. So other causes in the left to right hand, there is a there is a there is a hole inside the interventricular septum, and the blood will come from the left to right, and it will eventually cause the right-sided heart failure. Okay, and chronic lung disease, which we call cor pulmonary. In this case, what I mean that the lung cells, which we call alveolar cells, they get uh, they get they become hypoxic. So hypoxia will cause these cells to constitute the arterioles, and the right heart will it will require more energy to pump the blood from to the to to the to the pulmonary circulation, and it will eventually cause the right side heart failure. Okay. Now, clinical features. So we see jugular venous distension JVD. As you can see in this diagram, this woman has jugular venous distension. Why does this occur? Because there is a because because this jugular vein, it empties into the superior vena cava, and as there is a dysfunction of the right side of the heart, it will cause the jugular vein to distend. Okay. Now a painful hepatosplenomegaly. Why HSM? Because the as you all might know that the blood from the liver, from the spleen, it eventually comes into the inferior vena cava and drains into the right atrium. Okay, so as there is a dysfunction of the right 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 side of the heart, it will cause the pileup of blood in these systems, and it will cause the liver and spleen to enlarge. Okay, dependent pitting edema. Yeah. So in this case, what I mean that the um, there is increase in hydrostatic pressure in the leg, and it will cause the edema and eventually cause the dependent pitting edema. Okay. This slide shows a summary of all the important points which I have discussed in my this video only. Okay, so you can read this slide. Uh, it describes the left heart failure and the right heart failure. So that's it for today, guys, and thank you and bye.